Question number 5, Brian Whittle.
Thank you, Presiding Officer. To ask the First Minister what action the Scottish Government is taking to ensure that cases of Lyme disease are diagnosed and treated as early as possible.
First Minister.
We are committed to raising awareness of Lyme disease and supporting those affected with what is a complex infection. We have a multidisciplinary expert group dedicated to Lyme disease, which is part of the Scottish Health Protection Network. The Chief Medical Officer wrote last week to all NHS Scotland health boards and GP practices to highlight the important role they play, not only in the early diagnosis and management of Lyme disease cases, but also in promoting awareness of ticks and tick-borne infections amongst their patients.
Brian Whittle.
Can I thank the First Minister for that answer? In Petitions Committee, we have heard evidence from those with lived experience and on the chronic debilitating effects of the disease who say that their illnesses are not even being acknowledged. So, First Minister, what can the Scottish Government do for those patients who are bitten by a tick, infected with Lyme disease and multiple unidentified co-infections, miss their early treatment window because of that lack of recognition and develop the chronic disease?
First Minister.
Well, my initial answer set out what the Scottish Government is doing. Early awareness or awareness in order to aid prevention is vital here. That's why one of the focuses of the multidisciplinary group will be to look at that. Also making sure that clinicians, frontline clinicians have the information they need to diagnose and detect and therefore treat the illness. And of course, the letter that the Chief Medical Officer wrote last week was designed to raise that awareness and make sure that those working, particularly GPs across our health service, have the information and the awareness they need to ensure, firstly, prevention, but also early diagnosis and access to treatment of those affected.